Welcome to Scrubbed In and Speaking Out, the podcast from the Registered Nurses Union of Newfoundland and Labrador, where we dive into the issues facing nurses and the advocacy shaping the future of public health care in our province. So today I'm joined by Ashley Hunt, and Ashley is the Research and Education Specialist here at the Registered Nurses Union, Newfoundland and Labrador. Ashley is a registered nurse by trade. What her work here is to develop and educate our members. Ashley, thank you for joining us.
Thank you for having me. Happy to be here.
So our first question here today is why are we even here talking about professional practice?
We are talking about professional practice today because we know that it's a process that continues to be misunderstood and underutilized by our members across the province. And we know that it's an important tool that, when used effectively, provides nurses with really the only channel to report and escalate concerns that are not being addressed that affect their ability to provide safe patient care.
And why is this important for not only registered nurses and nurse practitioners, but also the patients in our care?
We have a responsibility to raise our voice and to report on situations that impact our ability to provide quality, safe patient care and put our patients at risk. And sometimes it's not necessarily that something happens, but that, a patient has been involved, had a delay in care. Sometimes that's not the case. Sometimes it's a near miss that we need to document, but it's just getting the message out there.
Why do you think, and what are you hearing, are the reasons and rationale why registered nurses and nurse practitioners do not document their concerns?
I think it's a common misconception among members that no one is looking at the professional practice forms. But what they don't understand is that not filling out the forms sends the opposite message, and that message is more concerning to us as a union and should be concerning to all of our membership. When those statistics those reports are run on the employer end and management is meeting with their higher ups and they're having discussions and there's been no professional practice forms filled out in a particular unit or department in the last 3 months, what message does that say? That says that there are no issues. Mm-hmm. We don't have any professional practice issues because we don't have these forms. And that is really concerning to us because we know that every day our nurses and our members are going in and working and they are facing professional practice issues. So we need to kind of get away from that complacency and reframe the mindset that it is part of your responsibility as a nurse to complete these forms. It isn't your responsibility to make sure that the changes occur. We have to work towards meaningful solutions, but the employer has a role to play in that. Your role is to voice those concerns. So you are doing your job if you're documenting them.
And I often say to nurses when, they say, oh, Yvette, at the end of a 12-hour shift, I just don't have it in me. Or what's the use, like you said. Mm-hmm. But we have an obligation. I mean, we have negotiated this language for a reason. Mm-hmm. So it's an agreement between Registered Nurses Union, Newfoundland and Labrador, the employer, and government.
Right.
Therefore, everybody recognizes the importance of documenting these professional practice concerns. Mm-hmm. And I also say, so as a union activist and a union leader, we always know that if something happens in the workplace and we end up before the college, if you haven't documented on your patient's chart that you did something, it basically means you didn't do it.
Right.
If it's not documented, it's not done. And I often say to nurses, so if you haven't documented a concern, there is no concern.
Right.
Because there is no record of it. So, yeah. What types of things or examples would be documented on a professional practice form?
We know short staffing is one and staffing related issues that we get a lot, but there are a lot of things that our members face that are professional practice issues that they may not be aware of. For example, not having the proper equipment or supplies to be able to safely perform your job and to take care of your patients. Another common professional practice issue that we encounter is doing non-nursing duties. That's like a very big one. Nurses are not able to provide the care to their patients in a timely manner because they are busy and held up doing things that is not within their scope or their role to do. And sometimes, in small areas, I know that may be part of their role, that they do, answer the phones and they have to go to the lab and, run down with blood work, or they might have to do portering because there is no porter. But when it's supposed to be 2 nurses working that shift and there's only 1 there in those small areas, then the impact of those non-nursing duties, it doubles and triples. So documenting that and exactly how that has affected your ability to provide care to your patients is what we need to see in the forms. It's not enough to say we were short-staffed and that's the reason why I'm completing this form. You have to say we were short-staffed and as a result, I'd spent X amount of time on the phone calling in, looking for staff. Or if you're on a night shift, maybe you spent all that time looking for staff for tomorrow because you had a sick call. And, the patients or residents in your care didn't get turned and positioned as per policy. So again, it's not just your standards of practice, it's your department, it's your facility policies that now you are not able to meet. And it is because of things that are outside of your control. So like you said, if it's not documented, it's not done. You wouldn't leave the unit without documenting and charting on your patient care.
Exactly.
You wouldn't. So you have to reframe and look at the professional practice process as not an option. It is your only avenue to document and to ensure that you have electronic or paper trail that states that I recognized and identified these concerns and these issues. I clearly stated how it impacted my ability to provide safe patient care.
I guess another question is, how does this difference? Because there's so many processes. We have our grievance process. We have our professional practice process. There's different forms of documentation. There's a professional practice form. There's a peers report. There's a CSRS, occurrence reporting. How do they differ from the professional practice process?
Yeah, and that's another thing, how, it's important to say that we recognize that nurses are being, they're overworked, they're working short. The climate that we're in, the healthcare climate, the environment, it's complex, and there's a lot of issues in a run of a day that would make it cumbersome for a nurse at the end of a shift to sit down and want to go through all these forms. But they all have a different purpose, and sometimes there is overlap, and the overlap could be beneficial, to addressing the issue. So you can't really pick and choose which form to complete. You need to complete all the forms. You need to look at all of this as part of your role, your obligation to to the public, to the standards of practice that you're upheld to the codes of ethics, but also the obligation to the employer. So the employer is asking for you to complete a peers and incident report about something that happened. So, for example, a patient fell, so you have to complete your incident report. You wouldn't leave the unit without completing that incident report because the employer has said that is policy, or a medication error occurred. However, why did the medication error occur? Why did the patient fall? Those reasons are professional practice issues that need to be addressed. So if you are taking the time to report a patient fall, or that a patient received the wrong medication or no medication because the situation on that unit at that time impacted the ability for the nurse to provide those things for the patient, then that is also a professional practice issue. So you need to complete the professional practice form explaining why the patient fell, or why the medication was delayed, because we were down nurses. We had a RN replaced with a PCA. As a result, the other RNs were having increased patient load. They had to do meds for more patients. So, supervision was reduced, and then as a result, a patient had fallen. So again, you're protecting yourself by documenting those processes. And it's not picking and choosing one or the other, because they're different and they're going to have a different outcome. Grievances, on the other hand, could be completely different, but sometimes they do overlap as well. A grievance and dispute resolution pathway will be followed when something contradicts or goes against our collective agreement. And, that involves maybe getting a shop steward involved or an LRO to work towards reporting those kinds of concerns. However, there are professional practice concerns that are also things that you can grieve. So sometimes they will overlap as well. As well, when the employer is not upholding their end of the professional practice process, there are times that we have grieved that as well, when they are not responding, they are not completing their forms, or there's nothing being resolved during the professional practice committee meetings.
Or the committee meetings are not happening.
Or they're not happening, or they're failing to meet their end of the agreement by, coming to the meetings and trying to work towards solutions. Then in those cases, it will involve grievances as well as professional practice forms. So there is overlap, and I know that can be kind of overwhelming for members, but they all serve a different purpose. And the same thing with, your occupational health and safety forms. We need to look at it as a whole and see the big picture of why it's all important. But you can't really pick and choose one over the other because they serve a different purpose.
And we'd often say, even when I co-chaired the professional practice committee, and we'd all, management, employer, we would discuss a form. And because of what was written on a professional practice form, so you were short-staffed, a patient fell out of bed, or was because of not being able to be supervised or being checked on every 15 minutes, that we would say, okay, so there should have been an occurrence report filed as well. And we often would go back to members and say, make sure you fill out an occurrence report. If there was violence involved, we would tell them you have to make sure that you also filed a peers report, because each one goes to a different department too, right? And every time, even with our labor relations officers and our volunteers, when someone comes to them with an issue or concern from their unit, oftentimes, as you said, it overlaps.
Yeah.
There's occupational health and safety, there's occurrences, but there's professional practice, and they're all intertwined together. And I think what we're trying to say here today is this is not an option.
No.
This is an obligation for registered nurses and nurse practitioners to report.
And I will say, just to add to that, is in that, the employer has those forms with the incident reporting and the peers reporting, and that is for their protection. It is not really the same as what the professional practice objective is for our members. This is how we protect you and keep you safe and protect your license, because we are giving you an avenue to give very detailed written documentation of the issues that you have seen that have impacted your ability to provide safe care to your patients and to uphold the standards of practice. It needs to be clear that if you were unable to provide the level of care that you were supposed to, it was outside of your control. It's due to things that you don't have the ability to change. So the professional practice, compared to the others, is really that way to document and protect yourself.
And the employer, even if there's an incident, an occurrence, they investigate. And it's no good of a registered nurse then saying, well, we've been chronically short now for a month and we've been telling the manager. There's no documentation to support what you were saying. So let's go through the process. So what happens when a registered nurse or a nurse practitioner identifies a concern that is a professional practice concern, and we've now established we have a duty to report that concern, what is the process? So I guess what I want to know, prior to documenting, what happens?
We know that the professional practice process, in theory, it's the same across the board, but we know in practice, it's not necessarily being followed the same way everywhere in the province. We are working on a solution to that on our end, as I'll talk about a little bit later. But to clarify, I'll share what the process is, but it's not necessarily that it will be this process forever. We might change it to make it more efficient or to be more in line with what our members are doing, especially as, Epic is implemented and integrated and the way that we document and report changes. We obviously need to keep that in mind. But for now, the first thing that a member would do when they are facing a professional practice concern is to try to resolve it at the lowest level possible. Like everything, like grievances, the same kind of thing. We want you to just have a conversation with your manager, with your supervisor, with whoever is in charge from the employer end of who has the ability to kind of change the situation. So that a lot of the times we know that is not going to bring about change because, of course, if it is something related to short staffing, if the manager has already exhausted, calling, there's no casuals available, there's no one to come in. A lot of the times a solution may not happen at the lowest level. Mm-hmm. So, we understand that, but we still don't recommend bypassing that because having that conversation, again, it's possible that it could bring about change, but it's just ensuring that you are going through the right channels. So have a conversation, informal, and if it's addressed there's no need for a professional practice form to be completed.
So you talk to your manager or whoever's on call mm-hmm. for the facility, because we do know a lot of smaller facilities. There might be someone, say it's Twillingate, yes. There might be someone on call that's in Gander.
Exactly.
Or Grand Falls.
It's a site coordinator right? Or something like that.
Or, administrator mm-hmm. person. And if the issue cannot be resolved that way with a conversation, then where would a registered nurse or nurse practitioner find the form that we're talking about, professional practice form?
So the professional practice forms currently, it varies how they are kind of shared in each branch, site, department. Everyone does something differently, but there is an electronic copy of the form available for all members in the province on the intranet. So nurses can go in and fill out the form, type it in and print it, or they can get the forms from their actual site. So it depends, I guess, would be branch specific, but you need to connect with your branch to see where those forms are and what their practice is. But there are some areas that still have the forms printed in triplicate in there, and they're at their desk at the nursing station, available for members to complete that way. And others don't have those paper copies. They just go in online and fill it out and print it. So the practices vary, but the process that you should follow once you complete the form is the same.
Let's say everyone got a form. The form is completed either electronically or it's completed as a paper copy. What happens then? What is the responsibility then of the registered nurse or nurse practitioner? What do they do with that form?
So this is where the process, is under review on our end, because we know that it's not the same everywhere what everyone is doing once they complete the form. As the process is now, as it stands, the direction is you complete the form within 7 days of the awareness of the issue. That's what the process says.
And of course, we always recommend that you fill it out at the time it's occurring, that shift, because trying to fill something out a week later mm-hmm. and trying to remember all the details. And I will say that we will be looking at timelines and that when we're looking at new collective agreement language during this round of negotiations that's upcoming.
Exactly. And like you said, the details will be more fresh after the incident, but we do have that 7-day window, if it doesn't get done right away, but we would encourage you to do it as soon as possible and fill it out with as much detail as possible. As I said before, you really need to relate back to why these issues have impacted your ability to provide safe patient care, or if they have put your patients at risk or actual untoward events have occurred because of the issues that you're identifying, then you really, without saying any patient names or using any identifiers, you need to explain how that has affected them. For example, if the patient was not able to be turned and positioned as per the policy because you were busy doing all these X, Y, and Z other things, you say what other things you were doing, and then you say how that the patient was not able to be turned and positioned. And likewise, if you had found out the next morning or the day after that the patient had developed a pressure sore, for example, or a red area that, is putting them at risk for a pressure sore, then you also have that documentation to clearly show that you weren't able to, it was outside of your control while you weren't able to provide that care for your patient. And then you have evidence or details explaining unfortunate results of that. So we really encourage these to be filled out with as much detail as possible. And then you have to make sure that you have a copy for yourself, for your records, and a copy will go to your manager, and a copy we will encourage to go right away to your professional practice committee. But that's not what it says in our collective agreement. So we understand that can be a bit confusing, but we're trying to kind of emphasize the importance of taking ownership, taking it in your own hands to make sure it gets to the professional practice committee.
The onus is on the manager to respond within 10 days once you file that professional practice form as per the collective agreement language. And then they're the ones then who are supposed to submit that to the branch committee or local committee.
But we know that the current language kind of leads members to believe that they don't have to worry about the professional practice form once they have done their part in submitting it or giving it to their manager. So that has caused professional practice forms to never, ever reach the professional practice committee. And I know Yvette can speak to this more, but we have heard of instances from our members where managers have, ripped up the professional practice forms in front of them, which is not, it's not appropriate. It's not okay. But we need to have the backup. We need to ensure that the members are not just giving their only copy to the manager.
And we've heard stories of, a manager moving from an area. And when the next manager goes in, because members are saying, but we've filed professional practice forms, but they never seem to make it to, the committee. And then they found a big stack of them in the office. And I'm not saying, that managers purposely did that. There's a big education component for management too, because we do have a big changeover in managers throughout the whole entire system of NLHS. So the last time when we made changes to the collective agreement, we actually said that we would do a joint education, not only for managers and our members or managers and our volunteers, but for all members so that everybody's on the same page. That's something that hasn't happened. And I will speak to the fact that the language is going to change with the next collective agreement, but also with the transition agreement. So the amalgamation of the 4 RHAs into NLHS, in that language, which is still not finalized, we've actually put in an escalation process for the professional practice structure. So once all of that is signed, sealed, delivered, then we will be doing that joint education, which Ashley, you will be taking the lead on, of course, for RNU.
Yeah. So I'm giving you the steps today, but I recognize that the steps are not necessarily what works best, and it's not necessarily what people are doing. And it's not really what we want you to do. We don't want you to wait for that response. Yes, your manager has 10 days to respond to your professional practice form that you've given to them. But if that 10 days comes up and you don't hear a response, you have to go back then and make sure that the professional practice committee has the professional practice form. It doesn't have to be a form. It doesn't have to come from the manager. The manager may never fill out their component, and you have to look at that as a response. No response from the manager is a response. So then you have to escalate. So the next step would be to ensure that your professional practice committee has your form for review so that at the next meeting, the discussion can occur about what issue you brought forward. Whether the management response is on it or not, it's not going to impact it being discussed at the professional practice committee meeting. So we really want to drive that part home, that you can bypass that step if you're not getting the response from the manager.
And I do see you do have the RNUNL booklet there. And I do know that many of the time over the years, members have gone to the college for assistance if they've been documenting and, nothing's getting done. And there is actually a reporting structure process outlined at the college too that they help you with. But they also help you with, knowing how to document breaches of standards of care, referring to your code. But there is an escalation process. And right now, even though there's nothing in our collective agreement or there's nothing in the professional practice toolkit to say, just because your form didn't get to the committee, just because you did your form, your work is done. It is not. You have to be accountable to ensure that your issues are being brought to the committee. So that's why we're going to be looking at changing timelines and also changing the language around who's responsible for ensuring that that form gets to the committee.
One paper copy and that's all that you have, and it goes to the manager. If that never goes forward after that, then there's no record of your documentation about the issue. So we really need to also encourage members to be taking those copies, keeping a copy for themselves, so they have that in their records, and also to create an electronic paper trail. If you have a in-person conversation with your manager and you provide them in person with the professional practice form, you should follow up with sending an email to your manager to reference your conversation, include a electronic copy of the professional practice form. Maybe that would be helpful in creating that timestamp so that you can go back then. If you're not getting a response, you can even reply to that email to your manager 10 days later. I am just wondering if you've had a chance yet to respond to the professional practice form.
That's a really good idea.
So those kinds of things are not in the current language. And again, it's a bit dated in that way, but now we have switched a lot of our charting and documentation processes across the health authority are electronic now. Epic is coming. So we, of course, got to keep up with those times. So we'll be, making changes.
And I guess we could talk about the elephant in the room, and that is the electronic form, which we've been discussing, with senior leadership and with government officials in the department for quite some time now, the past 2-3 years, 3 years for sure. And we've tried different avenues. A couple of branches do have an electronic form, but an electronic form will come once EPIC is instituted. We have been told that it will then be a priority. And once that's done, it will be a way then, it's just like the peers reporting. You'll be able to go in and, there's drop down menus, but there's also that circling back so you can see where your form went in that. So we are going to get there. Also, one thing that we realize is language says in our collective agreement that all the committees, their minutes are coming to RNU provincial office. That's not actually happening. So that's something we need to educate our branches on. And we've had some internal discussions already about where we would house these minutes. So we do have a meeting coming up soon, and there will be more information coming out to branch executives around sending in those minutes so that when an LRO gets a call from Ashley Hunt saying, we have this concern, we've been documenting this for quite some time, our LRO can then go to our system and find the copies of the minutes where this very issue has been discussed. And that is actually more information and everything for when we talk to the employer about an issue or concern and we can point to it and say, this has already been discussed and it's falling on deaf ears.
Yeah, and if LRO is brought in, because an LRO can be brought into a professional practice committee meeting as a consultant. Likewise, the employer can have HR or professional practice consultants on their end brought in to meetings. Then they can review records of previous meetings that have not resulted in changes for the professional practice forms that they're discussing. So if issues are ongoing and an LRO is involved, then they can go back and read through those minutes, and that helps them inform their meetings again, or if it's escalated further to the chief nursing officer, because that is the next step after. If it's not resolved at the professional practice committee level, then, it's a letter to the chief nursing officer, and they're supposed to receive a response to you within 30 days. So that's to keep those issues or those parts in mind too.
That takes me to the next question. And the next question is providing some examples of where professional practice issues and concerns were raised by our members and had a positive outcome.
Yeah, so this is what we need to do better at as a union and as members, is sharing our wins, or celebrating our wins, because changes do happen, and it is a result of the consistency and the hard work of our members in raising their voices and being advocates for their patients and completing the forms. It's just we don't see those changes overnight. It takes time. So, and because of that, it kind of the momentum dies off among members of seeing the importance and the value in the professional practice process. So celebrating, bringing awareness to some of the wins that we've had over the last number of years, we hope will encourage you to continue to use the process.
So some of the examples that I'm aware of in my own experience, because I was co-chair of a committee, and also in my role now as provincial president, gone to meetings, one unit was experiencing a mass exodus of senior staff. So here you have new hires coming in, you have all the international educated nurses coming in, brand new into the system. We have brand new graduates from the schools of nursing right here in Newfoundland and Labrador coming in. So on one particular unit, we had 14 new people coming to be orientated and mentored. But we didn't have any mentors. We didn't have any senior staff, even hardly. Some of the senior staff were 2 years, right? Or less than 2 years. So the staff documented, and they documented. And then we were able to get involved to escalate the issues and concerns. And we had discussions with the senior leadership and of NLHS. And what we ended up getting was 2 extra temporary positions, to an evening one and a Monday to Friday one, to actually be there to support, mentor, and educate all these new graduates and new internationally educated nurses coming into the system. That, to me, that's a win. And that is a result of documentation. Another area was an emergency department in this province that was struggling big time. We actually doubled the staff with all of the forms that were filled out, and I mean hundreds of professional practice forms. We doubled staff, we increased support staff. So we often talk about the lack of support staff and registered nurses or nurse practitioners having to do the duties of other healthcare providers or healthcare workers, clerical, physio, OT, social work. We're it. And everything's within the scope of practice of a registered nurse. So what we ended up getting was, in that particular department, we got portering services. We had the addition of licensed practical nurse positions, personal care attendant positions made permanent. We had lab come in, and we had EKG. So all of that to help decrease the workload of the registered nurses and the care facilitators in that unit so that they could focus on the patient.
And we need to share those wins. And again, some other wins that we have, again, when you talk about the support staff, I think people, they think it's just nursing, but, offsetting some of the non-nursing duties that you're doing and you're reporting on, getting something that may seem as simple as having the ward clerk no longer just does 8-hour shifts. Now they have 12-hour shifts.
Absolutely.
They've extended the shifts. So that's 4 hours where you're not putting patient charts together and, doing all the paperwork that comes with that. Do you have help for those kinds of things? That's really important. And those wins come from professional practice. But we also have safety concerns that, yes, occupational health and safety do get involved, but it's a lot of times the evidence comes from multiple avenues, like you said. So we've had security being placed in areas because nurses are reporting that they're, the safety, workplace safety and workplace violence that they're experiencing or at risk of experiencing in certain areas. So then they've added security personnel where there was none, or they've added locked access to the doors before it was wide open, or, plexiglass, things like that improve safety and protect the nurses and the patients. All of that has come from the documentation of the professional practice.
So sometimes members are hesitant, we know, to file professional practice forms. And it's for a variety of reasons. So nothing gets done, nothing changes. So that's just going into the abyss. I don't have time at the end of my shift. I've already done 12 hours, 16 hours, 20 hours, 24. I don't have it in me to file that report at the end of the shift. What do you say to them? What would you say to them?
Again, that rhetoric is very common. Is probably what we hear most from people. One, that they don't have time, and two, that they don't really see the value because nothing's being done. As Yvette and I just shared, there are many wins that come from professional practice, but it doesn't happen overnight. You're not going to complete this form on a Friday and come back on a Monday and have 2 extra core staff at it. It's just not going to happen, and that's not reality. So, getting that response in a timely manner, it's not something that's going to happen. So you need to kind of get away from that kind of thinking. This is being proactive, but this is for the long haul. This is to help improve the workplaces for you and for the future nurses that you are mentoring or going to mentor, and improving the workplace environments so that we don't continue to have the issues that we have with retention, with recruitment. We want people to want to work in as a nurse and to be happy in their workplaces. So, we need to ensure that everybody plays their role, and raising your voice and advocating for safe workplaces is actually your responsibility as a professional. As we have said, the standards of practice dictate that it is your role as a registered nurse to voice concerns and raise concerns when you see situations that are unsafe, unethical, or put you or your patients at risk.
So if they look at you and say, well, where do I get support to fill these out, or support for professional practice issues? So say you got members in an emergency department at your hospital, and they're having these issues over and over again, and they are documenting. What supports can the union provide?
Obviously, again, like we talk about when we are talking about resolving issues, we say, lowest level possible. And we take that route when we are looking for support too, from a union perspective. You would contact shop stewards if you're submitting professional practice forms and you never heard back on them, or you're not feeling that they're being put forward. And if the shop steward is unable to, provide a response, they will connect you, or you should all connect with branch executive members. Your branch executive members, they're going to be the people that are sitting on the professional practice committee. So they're going to be the ones that know what is being discussed in these meetings. They're the ones that are having these meetings. So that's, a first step, is to go that route. However, you might be something that you need to get your LRO involved in. If as a whole, your unit, and it's, not just you, but everybody is not getting responses from from the manager with regards to professional practice. Like Yvette said, if your whole, department is saying, we're constantly filling these forms out and nothing is being done, nothing's being addressed, then at that time it is escalated further up the channel, and, union office has gotten involved and will continue to get involved in those situations. Especially, again, some of that could be grievable too. So an LRO would be able to provide expertise in that, whether the lack of response and not following timelines or not following the collective agreement could be something that they need to go through the dispute resolution process with. So they would be your go-to as well. And for just filling out the forms and just some general information about the toolkit, you can find all that on My RNU.
And also, if you don't know who your branch executive are or your shop stewards are, and none of your coworkers can help, you can always reach out to RNU through our info account. So info@rnunl.ca. And also, as you said, our website, My RNU, and all of that should be included in your new member orientation kit. And most nurses, seasoned nurses out there, they do know about this process, but they also know the issues and concerns with the process, which is why we are continuously reviewing and changing. Finally, what are your final takeaways? What would you say to a registered nurse or a nurse practitioner? What would be the final takeaways, the most important parts of this conversation?
Yeah, so I guess to summarize, really the most important takeaways, first and foremost, is that if it's not documented, it's not done. And it doesn't just apply to the work that you do for your patients. Everything that happened on that shift needs to be documented. So anything that could potentially put you or your patients at risk needs to be documented. Looking at the professional practice process as part of the work that you do and part of the documentation that you do is really important. So that's my first key takeaway. Secondly, I want you to know that it's not all on you. It's a joint responsibility. It's not just the responsibility of the nurse to report unsafe workplaces. It's the responsibility of the employer. So they have a role to play. And if you are reporting and you are escalating the professional practice forms and nothing is being done on the employer end and they're not responding to you, then that's not okay. It's not about blame. it's not targeted towards them, something that the manager did specifically. It is to make our workplaces safer and better. So we need to be made aware, and you need to involve your shop steward or your branch executive if you're not getting anywhere and any responses from the manager, because we have to work together. That's in the collective agreement. So that's the second main takeaway. And the third takeaway is that, like everything, you are never alone. There are people here to support you. Your shop stewards are there to support you, your branch executive members, and all of us here at the union, our LROs. We are all here to support you. If you need more information and you need help, if you're unsure if something is a professional practice issue or it's something that you would grieve, then you can reach out and contact us. And then finally, I just want to thank you for taking the professional practice process more seriously. And I hope that this information will kind of drive home those messages that it's part of your role and your responsibility as a registered nurse and a nurse practitioner. You have a duty to report unsafe and unethical concerns in your workplace, and that is not new. It's just this process provides you a formalized channel to do so, to do what you have always been supposed to do. So we really hope this builds more momentum, because as we know, we are stronger together, and collectively our voices have brought about change. We just talked about some of the great changes that we need to continue to celebrate. So share those with your colleagues, share those with others, and know that if you continue to follow this process, we will hopefully have more safe workplaces and better retention of our members going forward.
I mean, professional practice is such an important tool that we have for protecting nurses and our patients. It is one tool of many, but it is a very important tool. And as you have referenced many, many times, it is our responsibilities as registered nurses and nurse practitioners to report and to document. And it really does empower nurses to speak safely, to speak up safely and professionally as well, to discuss our issues and concerns that impact the very people that we care for. Thank you, everyone, for listening to Scrubbed In and Speaking Out. We'll see you next time.